Up until Hurricane Dorian, we've been monitoring the hurricane's path, and when it made landfall in the Bahamas, we saw videos coming out of this hospital with water filling up as patients were being evacuated. Getting on the ground, meeting some of the staff, seeing that many of them had lost their homes in the storm, it really hit home. You could tell that they were tired. They were shocked that they hadn't processed everything yet, but they were still at work for days on end. So that triggered something in SBP, and we thought this is something that we need to support. So we started flying relief flights in early on, up to 3 flights a day, to bring in new scrubs, clothes, hygiene items, and bottled water, so that staff who were at work and weren't able to go out and advocate for resources for themselves and their families would be taken care of and be able to focus on the essential work that they're providing. Now 18, 19 months after the storm, we've built this reverse osmosis unit here at the Rand Memorial Hospital and several other clean water initiatives at clinics spread across Abaco, Green Turtle, and Grand Bahama to make sure that the frontline clinical workers don't have to worry about that they can continue to provide care because the water will be used in the operation of those clinics and hospitals, but also that they can fill up the water as they're leaving shift, that they'll be able to take that home for their families, and they'll be able to provide this water for the community who's also going to be struggling to find some of those resources after the storm. The main vision that we had for this was, how do we increase community resilience? How do we marry water purification and healthcare and find a way for those two to have synergies and work together? And we found a great partner in the CDC Foundation who funded this project and has been an advocate and a huge supporter of this work, and the partnership that we've created with the Public Hospital Authority, SBP, and Water Mission to make sure that we implemented these projects successfully, that we're doing the training, that we're doing the handover, and making sure that there's a long-term plan for maintenance, operation, and troubleshooting any problems that might arise with these systems so that they'll last for decades.
Okay, this project came about immediately after the Hurricane Dorian. The Grand Bahama in itself was without electricity and without water. Once water is restored, the water is very salty and basically undrinkable. We met SBP, Andy and the crew, and conversations began. How could we resolve this particular matters? SBP, along with Andy, brought in a crew, Water Mission, and sat down and collaborated on how to facilitate what you see before us today. And in that collaboration has brought about us we already had some infrastructure in sight, and we were able to bring in this RO plant in order to be able to generate the 55,000 gallons we needed for the hospital, as well as twice that amount in case of a natural disaster that we need to be able to support the community in its efforts to provide potable drinking water. One of the main things we understood how vital potable water was. We, as an island-based community, always had fresh running water. The water lens is very low. But once the water lenses was contaminated with the salt water, we realized the entire Grand Bahama Island and the Abaco's water lenses were compromised. What we did, we worked along strategically with SBP and others to understand what Grand Bahama needed. There's a fishing hole road that divides the island in inclement weather that takes care of, once you cross that, the only things you have is a community of 8 Mile Rock, which is the largest community on the island, and the West End area. With that water compromise, what we also did was put a small RO facility at the 8 Mile Rock Clinic. It's about 10% of the size of what we have here, less complex. But what it also provides is ample water, potable water for the entire community of West End, 8 Mile Rock, and all the areas in between. What we plan to do is run those RO systems continuously. And again, it is, as this one is, it's going to be sustained and maintained through collaboration with SBP and others. And we're now training up our own local persons in order to be able to facilitate the particular maintenance and upkeep.